The views expressed on this program do not necessarily reflect those of this station.
Welcome to Insights into Northeast Michigan, a WBKB News public affairs program. Insights deals with the issues affecting those in the community, as well as Northeast Michigan and the state. And now, Insights into Northeast Michigan.
Welcome everyone to this edition of Insights. I'm your host, Felina Jones, and today we will be talking about community health events that are hosted by the ARMC, and today to visit me is Melissa Tolan-Halleck, who is the community educator at ARMC. Thanks for visiting here today, Melissa.
Thank you. Good to be here.
So a lot of things going on for the hospital this summer. What kind of events can the community get involved in?
Well, we'll talk a little bit further about the health walks. That's an exciting topic to talk about today, so we'll talk about that. But we also have some different health talk events, and we had one about a month ago on calcium. And we have a waiting list, in fact, for that. So we're planning on having another discussion. What we're doing is bringing in physicians, bringing in experts on different health topics, and just going ahead and working with what the community needs are and offering different topics based on what their needs are. And there's a lot of talk on calcium and heart disease and so on. So that was one topic that we did. What's coming up next is on August 7th, we are having a talk on Whole Foods. What events, or what does it mean? You hear a lot, it's kind of a trendy term, Whole Foods. And so we'll talk about how that affects your health. What does Whole Foods have to do with chronic health? What does Whole Foods have to do with the health of your body, of yourself? So we'll talk about that, some tools, tips, and we'll also offer a healthy lunch that is an option to purchase that day. So it's a short event meant to be done at lunch hours, or won't take up a whole bunch of your day. And from there, we also are doing different farmers market events. And at these events, we also not only are offering tips and health tips, different informational things, but there'll also be some type of a screening. One will be a diabetes screening, and that will be a risk assessment test, and there'll be individual consultation available at that event at the farmers market. The other one will be more of there'll be some blood pressure screening and so on. There'll be some information on the 5210 campaign, which I know I've talked to you about before. The 5 fruits and vegetables a day, 2 hours or less screen time, 1 hour physical activity, and 0 sugared beverages. It's a perfect fit for the hospital, for the farmers market, for the community in the summer. So we'll be talking about that on the same day that the farmers market is doing their Play It Again sports activity. So they're going to be signing people up for sports events, giving away, in fact, some sport equipment that has been donated. So they really want our community to become active. And so we're piggybacking and collaborating with them on that, and talking about how can we decrease screen time, how can we increase fruits and vegetables, what are ways to do that, and how the whole family can do that. So that's another topic. And then another farmers market event will be the weight management and Whole Foods, weight management and the farmers market. How does that fit together? And so there'll be some information coming up on that also. So you can look at the farmers market website. You can also look at our website, myarmc.org, and get these exact dates for these events. But those are some specifics throughout the summer.
And along with those events, one of the biggest events that you guys are really doing is the community walks, where you guys have a session throughout all the summer with different walks featuring different doctors. How'd that kind of come along? Excuse me.
That came about last year. I kind of began the community health walks, and that was I was new back to the community and really wanted to see people out moving more in our community, and it did. It worked. We got out. We were walking, but I think people wanted a little more structure, and so we have a little bit more structure involved with this. It's a specific time. There are maps that you can pick up at the event, and along with that, which has been a huge positive, and people have really enjoyed this, is we're bringing along a physician to each walk or each ride. There's a bike ride coming up, which we're going to talk about in great detail in a little bit here, but the health walks have been great. We've had really great turnout and lots of positive feedback. These physicians that come to each walk will do a 5 or 10 minute discussion on the topic for the day of that walk, and then they're also available for question and answers, and most importantly, you get to meet them. These are new physicians in our community, so they get to meet them and just see who they are, so you can see who this new physician you've heard about is, and ask questions, and then walk along the river with them, or take a bike ride with them and the rest of your community members down one of our new trails. So it's been a great event, and Blue Cross Blue Shield actually collaborated with us also on this event, and we can talk about that more soon here. But there's some extra excitement that comes along with that.
Benefits.
Some benefits for sure.
Okay, and why is it so important for the hospital to kind of collaborate with the community and get people active and inform them about health awareness?
Well, my position with the hospital is really to be that bridge from the community to the hospital. So I not only look at the hospital and what their needs are and the physician needs are, because the physician is who is the front runner, who the community members are going to.
Right.
And they kind of see what some of the needs are in the community. So I go to them and say, what are their needs? What do they see as the need in the community? But then we also go to the community and we look at the community as a whole and what are some of their needs, and bridging that information, because I think there's a lot of things that go on in the hospital that people aren't aware of. It's not always just a place that you go to when you're acutely ill. It's a place, a resource, a great resource for our community. So I'm really excited to get that information out.
Good. And how do you guys, because there's several different doctors that are highlighted throughout this summer for all the different sessions, how'd you pick which doctors?
Well, we again looked at some of the community concerns and questions, and also chose some of our physicians who are newer to the community. Not all of them were, but some of them were. Like Dr. Mussman spoke last month, and that was received very well. He's doing all kinds of things, everything from reconstructive surgery after cancer to cancer prevention with mole removal and things of that sort. So I don't think people really understood exactly what he was doing in our community, and so that was a really nice asset, and he enjoyed it a lot, being able to talk to the community. So that one made a lot of sense. Dr. Frank will be coming up here at the end of the summer at our last walk in September, and he is our internist in town who specializes in gerontology. So it's great to have someone like him in our community and have the knowledge that he has. He has a lot of knowledge on chronic conditions, which is what a lot of our community faces. So that's a huge asset. And then, of course, the pediatricians. We have 2 new pediatricians coming. So we're excited to introduce them to the community in a fun atmosphere at the Duck Park, at the Island Park. We'll be doing our walk there in August. So that will be a fun event that children, families alike, they're all open to families, children alike. But this one with the pediatricians in particular will have some fun kid activities.
Okay.
And then, of course, I'm sorry to Dr. Lombardo, I hate to not mention him. He's new to our community and an allergist, so that is a great ear, nose, and throat, an asset we didn't have here in our community for a while.
Definitely. So new doctors, and along with the new doctors that are coming into the community, I guess the theme of the walks are dependent on what their
expertise.
Okay.
Based on their expertise. So they are the expert that you're getting to hear straight from their mouth. And our slogan has become ARMC is walking the walk. And I think that's fitting because our physicians aren't just telling us to get out and be active.
Right. They're doing it themselves.
Our orthopedic surgeon, who will be here later today, is not just saying you should be out riding your bike, you should be using your joints. He's going to actually be there with you doing it. So I think that's a neat concept.
Okay, great. Well, thanks, Melissa. When we come back from the break, we'll talk a little bit more in depth about the community walks and see how you can be a part of them. Welcome back from the break. Before we left you, we were talking about all the different events that the ARMC has in store for the community this summer. And Melissa is joining me now to talk a little bit more in depth about the community walks that you guys have set up. So as far as the community walks go, what can people expect out of them?
Well, when you arrive at the community walks, it's probably helpful to arrive 5-10 minutes early because they have been getting quite popular, which is great. And when you arrive at the community walk, you'll have an opportunity to register. And with that registration, that puts you into a drawing, and that drawing at the end, at our last walk on September 14th, after that last event, we are going to be drawing and giving away health initiatives. And those health initiatives will include a kayak with a life jacket, of course, and a carrier to go in your car.
First.
Absolutely. And so that's helping. Our whole idea here is if we're going to give away health initiatives, we want that to be something that can maybe inspire you to be doing a new activity.
Right.
So a kayak is a wonderful asset to have in this community. There's so many places and so many neat things you can explore that you wouldn't be able to without access to the water.
Absolutely.
So that is one thing we'll be giving away. And in addition to that, So every time you come to one of these events, you go into a drawing. So if you come to 4 of the events, you're in there 4 times. So your chances are better. And also we'll be giving away $100 gift certificates for Masters Lalone shoes so that you can buy new walking or running shoes. And those prizes, if you will, or initiatives, are able to happen because of our collaboration with Blue Cross Blue Shield. They were excited about this opportunity in the community and wanted to be able to help us out, and so that's a great asset that we weren't sure we were going to be able to offer, and so we're really excited about that. So you'll have the opportunity to sign up, which puts you automatically into that drawing, and then in addition to that, there will be at this upcoming on this Wednesday on the 17th of July at 6:30, we will be giving away a bike that Cobblestone Cyclery donated to the cause. So they also are very excited about this idea of the community becoming active and doing it with a physician. The physician collaboration piece, they really liked that. So they graciously donated a bike for us to give away, so we'll give that away that night. So, and you'll have the opportunity to also register for that. And then we'll have some healthy snacks and for before or after the event. And then we will have our expert, which will be Dr. Vornkamp at this event coming up, but there's always a brief 5 to 10 minute discussion that the physician healthcare provider will offer. And you're guaranteed to leave with a little bit of information you didn't have before you came there.
Right, and that's the thing. People are not only getting exercise and getting active, but they're really learning about healthy ways of staying active and eating and nutrition. You guys also do like a mini expo is what we've called it in the past, right?
Absolutely. The mini expo would include health resources that we have at the hospital. So you'll get information on our diabetes programs. You'll get information on our various programs that we offer. So we do have information there. The 5210 information is always being dispersed. So you can pick up pamphlets, pick up resources, and some free giveaways. And in addition to the free giveaways, there's always some kind of a screening. We did bone density at one of the events. This event will do free blood pressure screenings by a nurse, so you'll have an accurate, reputable blood pressure screening to take with you. And that's a nice thing to have done because you should be nice and calm and relaxed at this event, so it'd be a real good time to get a blood pressure screen done. And after the event, so then once the talk is finished, the 5-minute talk from Dr. Vornkamp or whoever is talking that night, then the ride will start, or the walk, if you will, if it was a walk. But we will, there's a 3-mile route, so you go out 1.5 miles and come back, so children are more than welcome to attend. And then there's a 10 miles, so you can go out 5 miles and come back. And this is a new trail that I don't think a lot of people are aware of in our community. That was one of the reasons we chose this trail. And so it will be marked. It will be marked, it's out on US 23, and it's at the trail crossing that goes across 23, and it'll be marked well with balloons and a sign. So, and there's parking. You can park there, unload your bike. You could bike out there if you wanted, but if you want to drive out and have your bike on the back of your car, you're welcome to do that. And there is the stipulation of having a helmet. We really feel pretty strong that to ride a bike, to do it safely, adult or a child, we really should be wearing helmets.
Of course.
So that's something that we will ask that you do for this event.
And it sounds like because with the different miles that you can do, either the 3 or the longer one, it sounds like it's really not only a community event, but family oriented as well. Absolutely.
The more we can get families out being active together, we know that the best way for children to learn is to watch their parents or to participate with their parents. So this is a great way to do that.
And why is it so important to the hospital to not only get people active, but educate them?
It's really important. I think we make a lot of decisions without having the proper knowledge. And if we're making decisions based on our health care, based on our lifestyle, it's important to know, to have the knowledge. And I'm a firm believer, having a master's degree in education, extension education, and adult learning, that knowledge is power. And if we can have knowledge, and if you can know what's in our community, I'm really out there to be the positive face of the hospital and to show you the things that we do have to offer, and to show the community that they have some choices, and they have some positive choices that they can make.
And with that being said, what do you hope that the community will take away from these events? Because, I mean, you guys have a wide variety of different subjects that people can go attend. What do you hope they will take away from the whole series?
I hope that they will leave with a bit of information, something they didn't know. I know when I heard Dr. Mussman talk, I know that topic, I know the topic well, but I left knowing something different that I didn't know before I came. So I hope you leave with a little bit of information and that you spread that information, because we know negative spreads fast. Well, I hope positive spreads fast too. So if you learn something, that's often, if you look at research, where we get our information is from our family, from our family and friends. And so if our family and friends have good, accurate information, then our community is going to be more informed.
Definitely.
So I hope that happens, and I hope that people have fun. If we're having fun, and it's always fun to have a little chance to win something exciting.
Right. A little initiative.
And a little initiative, there's nothing wrong with that if it's a healthy initiative. And I hope that they realize that you can do fun activities. Your family will have fun. You know, even your 11-year-old, 10-year-old son, getting them out there, they may put their heels in at first, but you know what, when they get there, they're going to have fun. They're going to get a free t-shirt. I didn't mention that also. Okay. Everyone gets a free t-shirt that participates. So there's lots of extra healthy initiatives to come out and have some fun.
Definitely. And then once summer kind of wraps up, the series comes to a close, but you guys are also doing expos as well, correct?
Absolutely. So this is kind of our summer event, and actually this is fresh off of my tongue right now, but I'm hoping to extend this through. It doesn't have to end in the summer.
Okay.
So we're hoping to kind of do this per season, do something similar to this.
Oh yeah, that would be nice.
And so that's something to look forward to. But we also have our health expos, and we do those senior focused, family focused, and those really kind of kick off in the fall. So it's a good time to do this type of event, get out more information, and you know, it's flu vaccine time, so inform people of their options they have there. So it's a look forward to that information. Of course, continue to look forward for our health talks, which I mentioned earlier, and various topics, and various experts will be speaking. And then also we have just all of our various classes. The smoking cessation is always something that we will continue to work on. So looking for, you know, look at our website. It's a new website, myarmc.org. And it's up to date, so the stuff that's going on will be on that website.
All right, fantastic. Well, thank you so much for joining me
Thank
today
you.
and talking about all the great things that ARMC is doing for the community.
Thank you.
All right, well, when we come back from the break, we'll talk to a doctor who is in charge of one of the events and who is going to be the key speaker. Welcome back, everybody, from the break. And now Dr. Vorn Camp joins me, who is an orthopedic surgeon at ARMC, and he is also one of the featured speakers at the Community Walks. Thanks for joining me.
Oh, thank you for having us.
Yeah, definitely. So tell me why you decided to get involved with the Community Walks this year.
Well, a lot. You know, Melissa and I were involved with the Building Healthy Communities program through the health department, and we're basically looking at childhood obesity and then adult obesity as well, and how do you prevent some of these chronic diseases or help treat them other than medication, and by choosing an active, healthy lifestyle. So it's been fun to look at this. You know, how do you get people back active again with injuries? How do you keep them healthy from a young age until adulthood? Because I think if you eliminate some of the childhood obesity issues that we've got, give them more infrastructure through the road commission, and the roads are safe routes to school, streets that we can walk or bike on, then we can have a more active lifestyle.
Right, definitely. And I know we were just talking about the fact that not only is this event for you to kind of have a discussion with the people and inform them about healthy lifestyle, but you yourself are actually going to be on a bicycle and biking around the trails as well.
Sounds a little bit scary, doesn't it?
Yeah.
We really recommend everybody, of course, wears a helmet. I think that's one of the first things. I've talked to a couple people and they say, well, I don't have a helmet, but you know, if you break a bone, I can put it back together, or my partners can put it back together, and we get you back healthy and walking again. But if you damage your brain, it's really, and it's pretty easy to hit the wrong bump or hit a tire. And if you don't have a helmet, and just riding to the store, and I see so many people that don't have helmets. And there's a nice bike store in Alpena, as you know, and I think you know, it's so simple. They're not that expensive, and a lot cheaper to buy a helmet than it is to have an injury and have irreversible brain damage.
And would you say by you biking yourself along with the community, you're kind of leading by example?
Trying to, right. You know, I've had some injuries myself, and so I used to enjoy running and doing things like that. I can't do that anymore, so biking is one of those things that I can enjoy, and it doesn't bother my joints as much as walking or running would.
Right. And that's another thing that I really wanted to touch on as well. How can people, you being an orthopedic surgeon, how can people live a healthy lifestyle post-surgery?
After surgery? Oh, it's pretty simple after surgery. It's sometimes leading up to that they sometimes become very deconditioned, and so a lot of times we'll prescribe therapy ahead of time, with a water therapy over the hospital that they've got. And I think the low impact exercise, and I think the therapists are very accustomed to working with injured or elderly patients that have injuries, showing them how they can remain active with ambulatory aid, whether it's a walker or crutch or hiking stick, and then basically helping them recondition, sometimes in preparation for surgery. After surgery, a lot of patients, and I'm hoping a lot of them will join us for the Alpharus walk in August 31st, because that's again a community walk, or I think it's a mile or two walk, which I intend to do with hopefully as many patients as will join us and do that. But there's a lot of ways to remain active. Again, I recommend a lot of patients to use either a cane or crutch or hiking stick for walking before surgery, and then after surgery. If they have an abnormal gait pattern, hopefully we can correct that with the surgery and then with therapy afterwards.
Okay. And what would you recommend for people pre-surgery, and maybe people that don't even need surgery, but to kind of stay active and to avoid having to have knee replacements or hip replacements, those kind of things?
I think, if you think about it with the mechanics of a hip joint, if you walk unsupported on your hip, you're putting 7 times your body weight across that hip joint. So if you just use a cane or hiking stick in your opposite hand, you're taking away a lot of force, not so much for you, but a lot for me and a lot for a lot of my patients. You can take away a lot. And then with the knees, it's 4 times your body weight. And so a lot of times, just again, a cane or hiking stick will eliminate roughly, 800 pounds for a lot of us, 4 times your body weight across that joint by using a cane in your same hand or a hiking stick in the same hand. So walking's not necessarily a bad thing for all patients, as long as they use some simple things, good cushioned arch supportive shoe, a cane, crutch, ambulatory aid like a hiking stick. And then the strengthening exercises we do with physical therapy often are very beneficial. Weight training exercises, even light weights that they can do 10 to 12 repetitions of, are often very helpful to work on balance and coordination. And if you can't sit unsupported, it's hard to imagine you can walk unsupported,
right,
or ride a bike unsupported.
Exactly. So important to stay active. And I know ARMC is really trying to build a healthy community.
Yes.
Why is that so important?
We'd like to see our patients out at the stores, not in the hospital, of course. And we're spending billions of dollars on health care that probably is avoidable with a healthier lifestyle. I'd much rather tell a patient to go out and walk 30 minutes 5 times a week than prescribe an expensive blood pressure medication or diabetes pill. And I think most of the doctors and healthcare providers in Alpena recognize that we can do a lot to help them just by encouraging them to lead a more active, healthy lifestyle.
Definitely. And so being one of the featured speakers for the community walks, what do you hope people that attend your walk will take away from it?
Just understand that there are things other than walking or running that you can do. Like myself, I said I can bike, and I enjoy bicycling as one of my prime ways to keep relatively active and healthy. And again, if you're walking, ambulatory support, and really with the, I'd really like people to come, but to purchase a helmet for,
Definitely.
I'm sure the other stores like, sure Dunham's or other stores, probably Walmart, carries those helmets. But I think, I enjoy going to the bike shop because I know I'll get a good helmet, and he's real good about fitting for the helmets as well.
Right, definitely. Well, thank you so much for joining me today, and good luck on your bicycle walk.
Thanks.
Thank you so much. Well, that'll wrap up this edition of Insights. You can catch us back here next Sunday. Have a good one.
Insights into Northeast Michigan is produced by WBKB News. If you have any comments, suggestions, or topics you would like to see on a future show, please email WBKB News. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.